Hello, and welcome to this presentation for Entergy retirees. My name is Jennifer Rader, and I'm the Vice President of Human Resources Total Rewards for Entergy. Before we begin, thank you for your many years of service with Entergy. You've set high standards for those of us who follow in your footsteps. Entergy continually evaluates the benefits that it's proud to offer to its employees and retirees. As part of the evaluation, we've been looking at how the company can provide retired Medicare-eligible participants, those 65 and older, with health coverage options that best fit their individual needs and help them and Entergy manage rising healthcare costs. After careful research and analysis, Entergy will move certain retirees to a private health insurance marketplace via benefits for them to purchase their own coverage, which may be reimbursed through a company-provided health reimbursement arrangement. We initially shared these exciting developments and changes with you in a March announcement. By moving to an exchange, eligible participants may choose to enroll in a Medicare supplemental plan, a Medicare Advantage plan, a Medicare Part D plan, a standalone dental plan, and/or a standalone vision plan. Basically, participants will have more benefit choices to right-size their coverage. During this presentation, you'll get more details about VIA benefits, the plan types available, the enrollment process, the health reimbursement arrangement, and the actions you'll need to take. Please review all communications you receive from VIA Benefits. This information will contain important steps and dates you'll need to follow if you want coverage effective January 1st, 2021. As a reminder, it's also a good idea to make sure you keep your contact information current. If you've had any recent changes to your contact information, please be sure to notify Alight, the company that manages our Entergy Pension Resource Center. We're excited about the opportunities these changes provide because they empower you to select your own health care coverage based on your individual health care needs and help you and Entergy manage rising health care costs. We hope you share this excitement. Thank you for participating in our retiree meeting, and thank you again for your service to Entergy. Now, I will turn the presentation over to the VIA Benefits Ambassador.
Hello. Welcome to this presentation for Entergy Medicare-eligible retirees. My name is Bill Tisdale, and I'm a meeting ambassador for VIA Benefits, a part of Willis Towers Watson. As you view this presentation, I hope that you find what I share to be informative and helpful as you consider changes in your healthcare coverage. First on our agenda, I'll talk about who we at VIA Benefits are and explain the transition from your current Entergy healthcare plan to individual Medicare plans that you choose through VIA Benefits. I'll explain the basics of Medicare, the types of plan options that you'll have, and how those options can work for you. We'll talk about the VIA Benefits enrollment process and what you can expect when the time comes for you to enroll. We'll introduce you to your Health Reimbursement Arrangement, or HRA account, and how you can use that to help pay for your medical expenses. For our final topic, we'll go over the steps that you may need to take within the coming months. With that, let's get started. Hundreds of employers of all sizes, both public and private, including many of the largest companies in the world, have trusted VIA Benefits to help their retirees when it comes to Medicare. VIA Benefits is the first and largest private company to offer this service. Over the last 15 years, VIA Benefits has helped over 2 million people transition to individual Medicare health insurance, and we've completed these transitions with continuously high customer satisfaction. We're not an insurance company. We're an insurance marketplace. We offer plans from over 120 national and regional insurance companies. which gives you a wide variety of choice, so you can find a plan that meets your individual healthcare needs and budget. VIA Benefits is available to you online 24 hours a day, 7 days a week, or on the phone Monday through Friday from 7 a.m. until 8 p.m. Central Time. We have an online help and support center with hundreds of articles on how to use our tools and services, as well as information about Medicare. During our business hours of 7 a.m. until 8 p.m. Central Time, we're available to help you. When you call our toll-free number, you'll reach one of our 3 service centers in Utah, Arizona, or Texas. All of our benefit advisors are based in the United States. They are trained to help you choose and enroll in health insurance and to act as your health insurance advocate going forward. Not only are the calls to our service center advisors toll-free, but there are no fees for the advice or services that they offer. VIA Benefits offers all types of individual Medicare plans. That includes Medicare Advantage plans, sometimes known as Medicare Part C, Medicare Supplement insurance policies, also known as Medigap plans, and Part D prescription drug plans. I'll go into further details about each of these in a moment. In order to find insurance coverage that fits your individual needs, it's important to us that you have different plans to choose from. So we work with over 120 national and regional insurance companies. Some of their logos are on the screen now. Whether you recognize the insurance company or not, VIA Benefits is diligent in only allowing plans on our platform that meet high industry standards. In addition to individual Medicare plans, we also offer dental and vision plans, which are not Medicare plans, but they can enhance your healthcare coverage. Medicare insurance coverage begins with a foundation of Medicare Parts A and B, also called Original Medicare. You must have both Medicare Parts A and B in order to get the additional coverage from individual Medicare plans. While Original Medicare covers a lot of things, it doesn't cover everything 100%. There are some gaps in the coverage, and because of these gaps, Medicare allows you to enroll in additional coverage that gives you enhanced medical protection. Your new coverage will be in one of 2 forms, either a Medicare Advantage plan, which typically bundles in prescription drug coverage, or a Medigap plan option, to which you can add a separate Part D prescription drug plan. These individual Medicare plans are not family or group plans. Each individual selects the plan or plans that fit their personal health insurance needs. In addition to these Medicare plans, we also offer dental plans and vision plans, which are not Medicare plans, but they can enhance your healthcare coverage. Now, let's talk about these 2 main options in more detail, starting with the Medicare Advantage plans. Medicare Advantage plans are offered by private insurance companies who have contracted with Medicare to provide plans that are designed to be as good as or better than Original Medicare. Medicare Advantage plans provide all-in-one plan coverage, which bundle hospital and medical coverage and most of the time include prescription drug benefits too. They also can provide other benefits that aren't covered by Original Medicare, like dental or vision coverage and even gym memberships. We call these pay-as-you-go plans. The monthly premiums you pay can be quite low, even $0, but there are co-pays, co-insurance, and possibly deductibles associated with the plan. So the more care that you need, the more you will pay. Conversely, the less care you need, the less you'll pay. So these plans can save you a lot of money when you're healthy. And Medicare Advantage plans place a lot of emphasis on preventive care. Medicare Advantage plans are network-based plans. This means that they each have a network of doctors and facilities that will accept the plan. The 2 main types of Medicare Advantage networks are the HMO and PPO types. HMO stands for Health Maintenance Organization. PPO stands for Preferred Provider Organization. An HMO has a narrow network. Your coverage comes from doctors in that network. If you need to see a specialist, you probably will need a referral from your primary care physician, and the specialist will also be in the network. PPO plans have a wider network. They will allow you to get care from a healthcare provider who is outside of the network. In general, you pay a lower cost for coverage if you go to a preferred provider who is in the network than you would if you went to a provider who was outside of the network. Medicare Advantage plans are always guaranteed issue, which means they won't ask about your pre-existing medical conditions, and you cannot be denied coverage if you're over the age of 65. The other option is to enroll in a Medicare Supplement Insurance or Medigap plan. These Medigap plans work with Original Medicare to fill in the gaps in Original Medicare coverage. Medigap plans don't bundle coverage, so you'll need a separate prescription plan to cover your drugs. While this means that you'll be dealing with 2 plans and possibly 2 insurance companies, it also means that you have the freedom to choose separately the medical and drug plans that each fit your personal healthcare needs. Standard Medigap plans have no networks, which means you can see any doctor or go to any facility in the United States that accepts patients with Original Medicare. There are a few Medigap plans that are labeled Select plans. Select Medigap plans may have a defined network. A Medigap is a pay-up-front plan. The premiums for Medigap plans are usually higher than Medicare Advantage plans, but you pay very little, if anything, out of pocket once you start to use your plan. If you choose a Medigap plan, you may be asked to pay the first month's premium at the time of enrollment. Medigap plans have simple single-letter names in most states, like Medigap Plan K or Medigap Plan G. There are up to 10 different standardized Medigap plans that offer varying levels of coverage. For example, a Medigap Plan G is considered an exceptionally comprehensive plan. After you pay the monthly premium and the Part B deductible, the Plan G will pay for 100% of the remainder of your Part A and Part B medical costs for the rest of the year. 2 of the options, Plans C and F, will not be offered to those who first become Medicare eligible in the year 2020 or later. Medigap plans will be offered through different insurance companies, but the plan will work the same regardless of which company you select. That is, a Plan L from one insurance company will cover Medicare the same way as a Plan L from another insurance company. The difference in Medigap plans from one insurance company to another is the cost of the premium, as they each set their own premium price for their Medigap plans. So a bargain price does not mean less coverage. Let's take a few moments to discuss Medicare prescription drug plans. All Medicare prescription drug plans, whether they are standalone Part D plans or bundled into a Medicare Advantage plan, have the same basic structure, but they can vary widely in which drugs they cover and what they charge for those drugs. That makes choosing a prescription drug plan a very personal choice because most people take a different set of drugs than someone else. Prescription drug plans start with a formulary. Formulary is the name for the list of drugs that a plan will cover. Each plan can have a different formulary list, and each formulary will divide their prescription drugs into separate tiers. The cost that you pay will be determined by the insurance company and the tier level that they have assigned for your prescriptions. We usually see 5 tiers in a plan's prescription drug formulary. Tier 1 drugs will be the less expensive preferred generic drugs. Tier 2 is called non-preferred generic. Tier 3 is for preferred brand name drugs. Tier 4 is for non-preferred brand name drugs. Now the prices usually increase as the tier levels increase. Tier 5 is called specialty drugs for drugs that are very expensive. Medicare separates prescription drug coverage into 4 coverage levels that you can potentially reach during any given year. First comes the deductible level, which can range anywhere from $0 up to $445. Then comes the second level, which is called the initial coverage level. In this level, you'll pay a set copay depending on the tier level that the medication has been assigned to by the insurance company. This is very similar to most other prescription plans. If the full cost of the drugs that you purchased during 2021 reaches $4,130, then you move to the third level called the coverage gap or the donut hole. This happens to about 1 in 4 of Medicare enrollees. If you reach this level, you'll pay a percentage of the retail cost of the drugs, 25% for brand name and generic drugs. Most of those who enter the coverage gap level will remain there for the rest of the year. But your insurance company is required to keep track of one more thing called your true out-of-pocket cost. The true out-of-pocket cost is a combination of what you have spent on your drugs from the first of the year and manufacturer discounts while you were in the coverage gap. If that combined total reaches $6,550, then you will transition to the fourth level called catastrophic coverage. In this final level, you'll pay a minimum copay of $9.20 for brand name drugs and $3.70 for generics, or 5% of the cost of your prescription, whichever is greater. About 4% of Medicare enrollees will reach this level. This is an annual cycle, and each January the process begins again at the first level. If all of this leaves you scratching your head, you're not alone. Since most people take a different set of drugs than someone else, your experience with these levels can be quite different from other Medicare enrollees. Fortunately, when you enter your prescription drugs into your personal profile, our search tools can simplify all of this for you. In fact, I think that the most important thing that you need to remember about Medicare drug coverage is this. Our search tools will easily be able to tell you how these coverage levels will apply to you and give you an annual cost estimate for any prescription plan available to you, so you can make a confident and informed decision about your new drug coverage. Entergy will reimburse all out-of-pocket prescription drug expenses once the catastrophic level of coverage has been reached and a $250 deductible is met for those eligible for a health reimbursement account. You must submit proof that the Part D catastrophic level has been reached. You can use the monthly statement from your insurance company. More information about this benefit will be included in your VIA Benefits Guide to Reimbursement. Our next topic is the VIA Benefits enrollment process.
Good afternoon, and thank you for calling.
Hello, my name is Sanique. I'm a licensed benefit advisor with VIA
Benefits Insurance Services.
I have assisted my parents with this, and I know this can be a kind of a challenging type situation.
Mr. Jones, I just want to reassure you, I am Medicare eligible. I know exactly what you're going through.
If you're more computer savvy, try the website first. If you'd rather talk to someone on the line directly so you can get your questions asked at that moment, then pick up the line and call.
If we suspect that they're not ready to make a decision, we don't push them. We'll simply say, we're here to help you. We're here to advocate for you on your behalf. In the meantime, if you have questions, don't hesitate to give us a call. We're here to answer those questions to help you get through this process.
VIA Benefits helps you enroll in health insurance through an efficient and proven 3-step process. The 3 simple steps to enrollment are to prepare, gather your information, and create an online account. Review, use our Shop and Compare and other decision support tools to understand your options, and then enroll. Enroll online. It's fast, secure, and easy. You should have received a booklet called the Getting Started Guide in early August. This booklet will help you prepare for your upcoming enrollment by providing you with the information you'll need to prepare for the enrollment process. You can save time by going online to set up your profile prior to your enrollment call. Once you've read all of the materials from Entergy and the Getting Started Guide, you should go online, create an account, and set up your personal profile. We ask you to create an online account at VIA Benefits and add your information so our decision support tools can show you the options which meet your specific needs. When you create an account, we ask for your personal information. This includes details such as your name, email address, and telephone number. Please note, we never sell or distribute your personal information. If you provide us with an email address, we will send you communications via email, like newsletters and other Medicare-related information. You can easily opt out of emails as well. Entering your prescription drugs in your profile will help our search tool find the prescription drug plans which cover the drugs that you're currently taking. We'll also ask for your Medicare ID number and the effective dates for your Medicare Parts A and B. Essential doctors are the ones you currently see. If you're interested in Medicare Advantage plans which have a network, we want to ensure that your doctors are in the network. The final preparation is optional. Schedule an appointment with a benefit advisor during open enrollment. Once you complete your online profile, you can set up an appointment with a benefit advisor online. Our benefit advisors are licensed and certified in plans across the United States. An appointment is recommended because your time is valuable and we want to pair you with someone who is knowledgeable about the plans available in your area. Setting up an appointment allows you some time to go through our website and shop for plans, or go to Help and Support and learn a little more about Medicare. In any case, we'll have someone available for you on the date and time of your appointment. If you prefer, you can review plans and enroll online. The next booklet that you'll receive is called the Enrollment Guide. This guide provides additional information about Medicare, how to review your plan options, and enroll online. You should receive your enrollment guide by early October. It will also contain the phone number to call and the web address. That number is 1-844-816-3757, and the website is at my.viabenefits.com/Entergy. This guide does not contain detailed plan options and information. You can view that information online by visiting the website at my.viabenefits.com/Entergy today. You may also schedule your call by visiting the website at my.viabenefits.com/Entergy. Shop and Compare allows you to view and compare Medicare-related insurance plans available in your area and sort them by price, plan type, insurance company, and other factors. With just a few clicks, you can compare plans side by side and review the details of plans that interest you. If you choose to create an account, you will also be able to enter your preferred doctors in the My Doctors section. This will help select medical plans like Medicare Advantage plans that include your physicians. Another tool on the website is the Help Me Choose tool. This tool will ask you questions about your needs and then recommends the types of plans that might fit those needs. You can then compare the actual plan details on the website. If you entered your doctors in the My Doctor section, you'll be able to see which plans they accept. One of the best things about the website is that it operates 24 hours a day, 7 days a week for your convenience. The address again is my.viabenefits.com/Entergy. When you search for plans, you're able to enter your prescriptions in your personal file, which will then compare the coverage of those drugs between all of the plans available to you. Once you've made the decision on which plan or plans you want, choose Add to Cart. Your shopping cart and the plan or plans you selected are displayed. Select Start Checkout near the bottom of the page. The Steps to Checkout page appears. Enrollment for most plans can be completed online. Each plan indicates whether a call is required to complete your application or if you can complete the enrollment online. During the checkout process, you'll be prompted to schedule an appointment to complete your enrollment if necessary. Follow the steps to checkout and enroll in the plans. 7 to 10 days after your enrollment, you should expect to receive a mailing from VIA Benefits called the Selection Confirmation Letter. This letter will list the plans that you enrolled in. Please look it over and make sure that you understand the information, and if you have any questions, please give us a call. The full plan details will arrive in separate mailings from each of the insurance companies with which you enrolled. When you create an online account, you can use it year after year to shop for and enroll in new plans. It's important to keep your profile up to date. For example, if you started taking a new drug, add it to your profile, so when open enrollment comes, you can compare plans based on the prescriptions you currently take. We also have a help and support page where you can find answers to most of your questions. These tools are always available to you 24 hours a day, 7 days a week. If you have questions about your plan, you can contact VIA Benefits during our business hours. It's time to talk about the Health Reimbursement Arrangement, or HRA. The HRA is a tax-free account established by Entergy to reimburse you for eligible healthcare expenses. As part of its IRS definition, you must pay first, and then you'll request a reimbursement. Funds will be available starting January 1st, 2021. You may use those funds to reimburse yourself for premiums on your medical, prescription, dental, and vision plans, and for out-of-pocket costs on other eligible expenses. Any unused funds at the end of the year will roll over to the next year. Here's how the reimbursement works in 3 easy steps. Entergy will allocate benefit dollars to each eligible retiree's HRA account. You'll then work through VIA Benefits to enroll in your individual coverage. In Step 1, you make the premium payment to your insurance company. In Step 2, notification comes to us at VIA Benefits that you want to be reimbursed for that payment. That notification can come from you or from the insurance company, depending on which reimbursement option you select. In Step 3, we process your request, check to make sure that you have the proper funding amount available in your HRA account, and then deposit it directly into your designated bank account. Maximize your account, sign in, set up, and automate. Improve, streamline, and automate your reimbursement experience. Signing into your VIA Benefits online account is a secure way to request and manage your reimbursements. You can set up direct deposit. This is the fastest, safest, and most secure way to receive your funds directly to your bank account. You can sign up for this feature online. Automate your premium reimbursement. You can turn on automatic premium reimbursement from your online account if it's available for your plan. Automatic premium reimbursement enables you to be reimbursed for your premium payments without submitting a monthly reimbursement request. VIA Benefits offers this feature for most insurance policies. Go paperless. Reduce the amount of paper mail you receive from us by registering for electronic statement delivery and notifications online. From the same web address, you can also check your current funding balance and see the status of reimbursement requests and related transactions like electronic deposits. Automating processes and using these steps help streamline and improve your reimbursement experience. There's an app you can download to your smartphone or tablet to better manage your reimbursement account. The easy-to-use VIA Benefits Account's mobile app is integrated with the website and intuitively designed so you can manage your HRA quickly. With the mobile app, you can check reimbursement status, check available balance, submit new reimbursement requests, take a picture and attach documents to your reimbursement requests, all from your smartphone or tablet. The mobile app is available for iOS and Android. Let's drill down into how our automated features work: direct deposit and automatic premium reimbursement. Automation is the most secure method to be reimbursed. Automatic premiums reimbursement is convenient. Once you set it up, the reimbursement is automatically returned to you on a monthly basis through direct deposit. This type of reimbursement can be used for premiums on the plans that you enroll in through Via Benefits. Over 90% of the plans sold through Via Benefits support this feature. When you choose automatic reimbursement, each time that you pay your premium to the insurance company, they will send Via Benefits notification of your payment. We will then send your reimbursement to you through the mail or deposit it directly into your designated account, whichever way you prefer. With automatic reimbursement, you do no paperwork at all. To receive your reimbursements in a fast, secure way, set up direct deposit. All you need is to provide your bank information for where you want the reimbursement to be sent and use the online form. It's safe, secure, and easy. You should be aware that it does take time to set up the notification arrangement with the insurance company. Not always, but sometimes this process can delay your first reimbursement for up to 8 weeks. But after the first reimbursement arrives, the subsequent payments will come regularly in a timely manner. If your plan isn't available for automatic premium reimbursement, you'll need to submit a request for your premium to be reimbursed each month. If you can be reimbursed for out-of-pocket costs, this is the same process. The only difference is you submit for out-of-pocket expenses as you incur them. Again, to improve this process, be sure to set up direct deposit. Direct deposit is the most secure method to be reimbursed. All necessary instructions on how to use your HRA will be provided in your reimbursement packet, which should arrive around the same time that your new coverage takes effect. This is a very important fact about your HRA. In order to continue to receive funds in your HRA, you need to enroll in a qualifying plan through Via Benefits before your enrollment period ends on December 31st, 2020, to have access to your HRA. And you must remain enrolled through Via Benefits each year to continue to have access to your HRA fund. We're just about finished. I just need to call your attention to a couple of important items. The next step to take is to prepare. Create an online account at Via Benefits and add your information so our decision support tools can show you the options which meet your specific needs. When you create an account, we ask for your personal information. This includes details such as your name, email address and telephone number, but please note we will never sell or distribute your personal information. If you provide us with an email address, we'll send you communications via email like newsletters and other Medicare-related information, and you can easily opt out of emails as well. Entering your prescription drugs into your profile will help our search tool find the prescription drug plans which cover the drugs you're currently taking. We'll also ask for your Medicare ID number and the effective dates for your Medicare Parts A and B. Essential doctors are the ones that you currently see. If you're interested in Medicare Advantage plans which have a network, we want to ensure that your doctors are in the network. Once you create your online account and enroll in a plan, you'll be able to manage your HRA from that same account. From your account, you can set up direct deposit and automatic premium reimbursement. In conclusion, I'd like to thank you for your time. I went over a lot of material, and you likely have many questions. If so, please feel free to call us at 1-844-816-3757, Monday through Friday from 7 a.m. to 8 p.m. Central Time, or visit the website at my.viabenefits.com/Entergy. We look forward to working with you soon. On behalf of Entergy and Via Benefits, thanks again for watching and have a great day.